thank you for having me here today. I pay my respects also to the Indigenous people of our country. And I've often thought, as a gay man myself, that there is a link between the size of the minority that identify as Aboriginal and the LGBT community. We are small in number. We have been stigmatised by the law. We have been treated with disrespect and to some extent are still alienated. And therefore we have things in common that we should strive to understand and work together to build a better Australia. I'm very glad to be at the Kirby Institute today because it's actually quite a big day for the Institute. Tonight at the Union and Schools Club, where the establishment gather as one does, the director of the Kirby Institute, David Cooper, is going to be receiving the James Cook Medal at the hands of the Governor of New South Wales. This is for his own outstanding research and his work in the Institute, and I'm going to be proud to be there. I've even bought a new dinner jacket. You don't get many opportunities nowadays. It's disgraceful. The establishment doesn't get opportunities to wear a dinner jacket. That's the least that we should do tonight, so it'll be a grand occasion. This symposium here today, the Flux Symposium, is a very good example of the very strong empirical basis that has been established by the Kirby Institute for researching areas of human behaviour and the passage of blood-borne diseases, which are the core of the work of the Institute. And one of my pleasures in being the patron is to come to occasions like this and to learn of the excellent research that is being undertaken. I congratulate Professor Garrett Prestige for his research and the team that he leads, and this day is going to be devoted to examining what that research has turned up. Essentially, the research has involved the study of the lives of 1,700 gay and bisexual men in their activities, their sexual activities and their drug-using activities, in order to understand the symbiosis between the two. Understanding it as to the risks that can be run from drug use in the area of sexual activity and sexual pleasure. It's important to mention sexual pleasure. It's an unmentioned and in some views an unmentionable subject, and I'm going tomorrow to La Trobe University, which is celebrating its 50th anniversary, to give a great big sex lecture, and I'm going to mention sexual pleasure because you can't talk about sex in any serious way unless you talk about the pleasure that drives people on in the pursuit of sexual encounters. The research has found the percentages that you're going to hear about during the day of the risks that are run, and in particular in the exposure to risks by reference to new and available drugs in the Australian community, ICE and the so-called ICE crisis in the access to drugs is going to be the subject of report, and this reporting is really an antidote to the extreme attitudes that are sometimes engendered by the media in alarmism, which can divert attention from the need for an approach that is one of harm reduction. If there's any lesson we've learned from the HIV epidemic, it is that harm reduction is the strategy that works. It works certainly in the long term, and it has to be the strategy of choice. I have learned this over the last 30 years because of my involvement in aspects of the international struggle against the spread of HIV and AIDS. And I pay a tribute here not only to David Cooper for his work in Australia, but to people like Jonathan Mann, who was the original head of GPA, the Global Program on AIDS. That was established in Geneva soon after Jonathan Mann came back from Zaire to lead the global struggle against HIV and AIDS. Jonathan Mann taught two big lessons, which I've never forgotten. One, that you always have to involve, and involve closely, people who are at risk. Not talking about them, not talking of them, not talking against them, talking with them and involving them in the talk. And that's why the empirical research that is undertaken and will be reported in this Flux Symposium is in the high tradition of GPA, Jonathan Mann, David Cooper, and everything that has been done since the very beginning. And the second great lesson was that in the issues of HIV, you must not build your strategies on prejudice, on myth, on fear, on demons, but on empirical data. That was taught by Jonathan Mann and by a great public health scientist who was a member of the original Global Commission on AIDS, June Osborne, Professor of Public Health at Michigan State University. And these two lessons are really the symbols of the type of work that Professor Prestige and his colleagues have been doing. The most interesting task that I've had in the last year is a task that was initiated by the Office of the High Commissioner for Human Rights in Geneva. Prince Zayed, of Jordan, who is the High Commissioner for Human Rights, has initiated an examination of the so-called overreach of the criminal law. This is the tendency in most countries for the criminal law to be pushed beyond what is legitimate and proportional for the task of the state in enforcing criminal laws with the backup of imprisonment and other punishment. And this exercise has taken me to a group of experts who have been meeting on what is the principle that should guide the creation of criminal law and what that principle should be when measured against the universal standards of human rights, the Universal Declaration of Human Rights, the International Covenant on Civil and Political Rights, the International Covenant on Economic, Social and Cultural Rights. All these statements of international principle lay down basic rights of humanity, and the purpose of the exercise of this new committee that's been established has been to look at the principles of human rights and how they work against the actual operation of criminal law in many countries. And I must admit, I was really astonished when I saw the figures in the United States of America, where there are 1.5 million people in the United States in federal prisons, and a very great proportion of them are in prison because of drug use, often relatively minor drug use. Apart from that proportion, 1.5 million, 500,000 are in state prisons. So that's 2 million people in their population who are in prison and often for drug offences. People are beginning to question. In the Obama administration, leaders were beginning to question the utility of putting very large numbers of people behind bars and to point out that for the purpose of the operation of any principle of discouragement or preventing people from using drugs, you could get exactly the same effect from having only 1 million people, or maybe 800,000 people, or maybe 500,000 people. So it's a tremendous burden in suffering, in loss of life, in economic loss of contribution to the economy, and to human pain. And as you approach this day, in looking at the interaction between sexual activity and drug use, I'd ask you to keep your eye on this issue of the overuse of the criminal law and the need instead to use harm reduction as a mechanism of reducing the unnecessary and dangerous exposure to drugs and to dangerous sexual activity, dangerous to the people themselves. So, I applaud the work that is being here by the team who are going to be describing their work today. I applaud the great principles which have been following us through in the HIV epidemic and the hepatitis epidemic and in other challenges to public health. I congratulate the team at the Kirby Institute. I'm very proud to be associated with them, and I hope that this will be a day founded in listening to the voices and upholding the principle of harm reduction. If those two great messages are kept in mind, and if they are sustained by the empirical research that is heard during the day, that will be a very important contribution of the Kirby Institute, a further contribution to enlightenment in Australia, to dealing with matters on the basis of evidence and not demons, and to encouraging our media, which isn't always alert to the realities of these truths, to do likewise. So I have much pleasure in, if this is what I'm supposed to do, launching this symposium and congratulating the members of the team at the Kirby Institute for the important work they've been doing.